there can be increased acid secretion, but this normalizes in a few days. Now, there is theoretical increased risk of Zollinger-Ellison syndrome, but that risk is only theoretical. This is observed only in rat models and has not been found in humans. Not in humans. Now, there is increased risk of small fundic gastric gland polyps. Earlier, it was said that there is increased risk of gastric atrophy and gastric adenocarcinoma with prolonged use, but that was not found to be true later. Now, proton pump inhibitors are category B drugs. They cross the placenta but are not teratogenic. In animal models, they have proven to be not teratogenic. What is category B drugs? It means that they are not teratogenic in animal models, but there are no sufficient studies available in pregnant women. There is only one exception to this, and this drug should be avoided in pregnancy, and that is omeprazole. It is a category C drug. Now, what are the uses of proton pump inhibitors? First, peptic ulcer disease. So many uses are common with H2 blockers. Peptic ulcer disease, it can be NSAID induced or H. pylori induced. So for peptic ulcer disease, proton pump inhibitors are the drug of choice. Proton pump inhibitors are also drug of choice for GERD. Then proton pump inhibitors are also drug of choice for stress ulcers. Examples of stress ulcers could be ulcers occurring in patients who are admitted in intensive care units. There could be ulcers occurring in patients of burns, which are known as curling ulcers, and patients of head injury, which are known as Cushing's ulcer. You can remember R for R, burns, curling ulcer, and H, head injury, Cushing's ulcer. The fourth use can be Zollinger-Ellison syndrome, which is gastrinoma. There is hypergastrinemia leading to gastric ulcers. The treatment of choice for this condition would be surgery, but proton pump inhibitors provide relief. The fifth one is aspiration pneumonia prevention. And this sixth indication is only an indication of IV proton pump inhibitors and not oral, and these are bleeding peptic ulcer. So suppose a patient is admitted in emergency with bleeding peptic ulcer, then IV proton pump inhibitor help in formation of clot over that bleed. If acid production is too much, then acid dissolves the clot and there is bleeding. However, if acid production is decreased by IV proton pump inhibitors, then there is time to formation of clot and bleeding can stop. The IV available proton pumps inhibitor can be remembered by a mnemonic per P for pantoprazole, E for esomeprazole, and R for rabeprazole. All proton pump inhibitors are available orally. Proton pump inhibitors can also be used for complications of GERD. However, complications of GERD is an indication for surgery. Now, after proton pump inhibitors, the next category of drugs we will discuss is antacids. And the first antacid described was sodium bicarbonate. But it is not used anymore. Why? Because it used to present with excessive sodium load. And this used to be responsible for hypertension and edema. Also, it used to cause metabolic alkalosis. So, this sodium bicarbonate is not used anymore. Then came the carbonate preparations such as calcium carbonate, these used to lead to production of CO2 on reacting with acid. So this CO2 liberation used to cause belching, and it can also cause perforation of the gastric ulcer. So they also cause metabolic alkalosis and they are not preferred anymore. The third category of drugs could be aluminium, combination of aluminium hydroxide and magnesium hydroxide. This combination is good as it does not liberates carbon dioxide. So this is a good combination. Now aluminium causes constipation while magnesium causes diarrhea. Aluminium, constipation, magnesium, diarrhea. So you can remember this by a mnemonic. All MD doctors have a AC in their rooms. All MD doctors have AC in their rooms. So MD stands for magnesium and diarrhea, while AC aluminium and constipation. Aluminium is slow to act while magnesium is fast acting. So this combination is a good combination as antacid. Why are antacid useful? They provide prompt relief in pain. So if you need prompt relief in pain, then antacids are a good treatment. But they should not be taken over long term as they cause metabolic alkalosis. The third category of drugs are ulcer protective drugs. Now these drugs form a coating over the ulcer and thus protect the ulcer from irritation by acid. So ulcer protective drugs can be sucralfate, sucralfate is a complex of sucrose with sulfated ammonium. Complex of sucrose with sulfated aluminum. Adverse effects are there can be absorption of aluminum over long term. That can lead to renal failure in a patient. Now, bismuth colloidal bismuth subcitrate preparation can be used as an anti-ulcer agent. They are used in quadruple regimen of anti-H. pylori, not triple regimen, quadruple regimen of anti-H. pylori. We will discuss later what is this quadruple regimen for anti-H. pylori. So bismuth subcitrate is a component of that. Now prostaglandin analogs. So prostaglandin analog we use is PGE1 analog, which is misoprostol. It is especially effective in NSAID-induced ulcer. It increases secretion of mucus and bicarbonate and helps in increasing the defense of the GI mucosa. It also reduces acid production. Now triple regimen for H. pylori. So it includes a proton pump inhibitor which is given twice daily, clarithromycin, which is a macrolide antibiotic given 500 mg twice daily, and amoxicillin given 1 gram twice daily. So this is the triple regimen for Helicobacter pylori infection. Now all proton pump inhibitors are FDA approved for this use except pantoprazole, but pantoprazole is also used for this purpose. Now quadruple drug regimen, it is used if triple drug regimen fails or there is resistance to clarithromycin. In that case quadruple regimen is used, which has the PPI, colloidal bismuth subcitrate, metronidazole and tetracycline. So this is the quadruple regimen for H. pylori. Now new drugs. One new drug is tanatoprazole, which is a new proton pump inhibitor. It is not a benzimidazole and it blocks proton pump reversibly. It is a reversible inhibitor of proton pump. The other drug